All right, aloha everyone. Welcome to another Dan and Friends. I think it's been probably about 2 months. So hope everybody has had a good summer. We're starting to go back to school and get back into the fall work schedule and so forth. We've had a busy few weeks here over the last couple of months, and a lot to share with you today. So I'm just going to jump right in and introduce our latest new friend. So Cecilia Trujillo, hopefully I did the pronunciation correctly. She comes to us from Colorado, so my old stomping grounds, and she is our new HR director. So I asked her to give a little bit of background on her and introduce herself. So, and HR directors are fun. Just want you to know that you do go see them for good reasons, not like quote going to HR. And she is a very cheerful, positive person, and I know you're going to be glad to get to know her. So,
well, thank you so much, Dan. Thank you for the opportunity, and aloha, everyone. I am thrilled and honored to be a part of the team. I came to Hilo. I think I landed about a week ago, and it has been just extraordinary welcome. I come from a system called Common Spirit, as Dignity Health and CHI at United, and have been in human resources for over 13 years. Returning to the islands, I used to be in Oahu, so super happy to be back. And like Dan said, we just want you to come and visit. I'm very relational, so want to get to know you. And yeah, the rest of the team has been super wonderful. I love the outdoors, so anything to do with outdoors, if you have festivals or anything, send them my way. I would love to get to know more of that about the community.
all right. I don't know. Yeah, any questions there on the side? Anytime we're going through the presentation, you can always put Cecilia on the spot. You know, that's part of Dan and Friends. You get to ask questions. So we'll be paying attention to that. What we have today in store is mostly updates, construction, Epic, a lot of different things going on. You won't have to listen to me monologue as much as usual, which is probably a good thing. So I'm going to shift over to Kris, and I think you want to just go ahead and start with your video, or I'm just going to turn it over to you.
Yeah,
best thing.
Let's just start with what's new on Epic. So a few months ago, we talked about our transition, and since then we've done a ton of work with our contracts team, and we have signed our Epic contract, and we are waiting for Epic to countersign that contract, and then we'll have more milestone dates. But the updates for today is two things. One, we do plan on going live in November 2025. And again, we are planning to take Epic's foundation build, and what that means is this is Epic's best practices for all hospitals and all healthcare organizations. So we are planning to try to stay as close to that foundation build as possible. We'll have more information on this in the coming months, and we'll be reaching out to each end user and each module user as we start to plan our go live efforts. So more to come on Epic. My next update is an update on meals. Always fun to talk about food. So we have a Bites vending machine that is being shipped to us and is in transit. This vending machine will be located up on the 3rd floor. It will be cashless, and it's sort of like a hotel mini bar that when you take the food off or out of that shelf, it does charge your card. So we're going to trial this with one vending machine up on the 3rd floor. We'll see how it goes, and we'll potentially get more if this is something that we find really helpful to the organization. So we should see this vending machine up on the 3rd floor sometime in late September. All right, more updates. So update on the parking lot and the restriping project. We have our maintenance team out there coning off different sections of the parking lot each day and restriping the parking lot. You can see in this picture, the cars that are parked in this line have restriped stalls, and then we're waiting for the weather to clear up so we can restripe this section that we coned off today. This project will probably take a couple of weeks to get through the entire parking lot, and then we will be restriping all of the gravel areas as well. Okay, so let's move into construction projects, and two projects that are new to Town Hall, but maybe not new to you if you have been working on these projects and helping us design these projects. So the first one is the Administrative Services Building 1, otherwise known as ASB1. The building sits in the old west, or is planning to sit in the old West Wing location. and will be situated right near the helipad. So our anticipated square footage for this building is about 17,000 square feet. This will be home to the new learning center, the new SIM center, our residency program, and a number of supporting departments that help our hospital and our organization. This will be a 2-story building, and this is just a design rendering. It may not look exactly like this at the end, but I think this picture is important because it shows the adjacencies to our current behavioral health building and our new expansion. So it'll sit right there to the left. The timeline for this is construction somewhere in August 2025 and a hopeful occupancy in October 2026. All right, the second new to town hall project that we're bringing today is the new labor and delivery recovery unit. And if this is new to you, let me just orient you to where we're going to locate this in the building. So this is the footprint of the second floor. This is the ICU. This is the OR. And this is where we're planning to construct the new LDRP. It currently houses our short stay unit, our ultrasound unit, and a number of other departments. So just this part of the second floor will be reconstructed, and we will be making it into an LDRP. We anticipate having 14 patient beds in this unit, 6 of which will be private LDRP rooms, 2 private isolation rooms, 3 semi-private postpartum rooms, an operating room, a nursery, and a bunch of triage areas. Design for this unit is already underway. We anticipate construction somewhere in October or before October 2025, and then hopefully an occupancy in late 2026. This will be a really nice addition to our hospital, and if you're planning to have children, just remember these dates. All right, what we're going to leave you with today is a video, a really exciting video of our construction efforts over in the expansion. We're also going to look at that new LDRP that I just talked about. We're going to do a virtual walkthrough of that, and then we're going to close out with our new Hamakua lanai, which has been in progress for over a year. Enjoy.
Wow, that was, oops, we're back again. Wow, that was, I've seen different parts of that video, but it was really well done and well put together. I hope people noticed the credits. We have our own little video, team here, and I seem like the more of these things we do, we keep coming up with more and more skills that we need to have here. If you have any questions about, I don't know, what do we have there on the side about the video? And so, let's see. Yeah, I would agree, it's cool. And I guess you got a few welcomes there, so forth. So a couple of things here. I just want to play on what, or add to what Kris said about the Epic update. It really is something that I think is going to be a bit challenging for us, but something that's very important is that as we roll out this whole enterprise, it really touches about everything we do, enterprise EMR, that we are that we take the best practice. It's an intentional reset of kind of where we were, and in some ways maybe a generational jump, or maybe that's a little bit overstated, but certainly a big jump forward. And what I don't want is to bring in too much legacy of what we're admittedly maybe comfortable with, but might not be the best practice. So you're going to hear me constantly talk about this and why it's important that we take this opportunity to get ourselves a little uncomfortable, but get into what I think is an industry best practice. So that could be you as a nurse and what you're familiar with, or you as a physician and your particular, favorites and orders. And how we look at labs. I mean, there's many different things that have become, I know, entrenched in our workflows, but I'm very optimistic, and frankly, I believe our organization is ready to make this change. So just you're going to hear that over and over, and that's for a reason, because that is going to absolutely be our stance as we roll this out. Epic is a big bite for us. We did sign our contract with them, so this is going to happen. It's moving forward, and I think you'll get more and more detail, just like getting more and more detail about these construction projects and things that we're doing. We also are bringing on some new staff. We're hiring experts, some which are here, some which work remotely. We're going to train a whole lot of people, including pretty much, let's say, 3/4 of the organization is going to get some type of Epic EMR training. That'll be a big lift for us, but I'm confident that we're going to do great with it. A couple other things, I think, just as maybe a kind of a global kind of commentary on what this year looks like, and also maybe a little commentary on what we've been doing over the past 2 years. The past few years, we've really been growing services here. We felt like we needed more in the community. We had an opportunity to add service, and it's just been a rapid, big push to do more for our community. And I think most all of us are very excited about that. But I think we're at a point now that much of our work over the next few years when it comes to operations is about being efficient and effective and providing a great patient experience. We got the building up, we got the people started, and now we need to get really good at what we're offering. And I'm excited about that. And I think that will be a really good focus for the organization. What we're going to be doing the next few years is truly building our physical infrastructure. I think that I was just looking at just the list, and from the new ASB building, which I've gotten familiar with that, the new West Wing, the new medical office building, the expansion, new parking lot, the family birthing center, the lab, and then we haven't talked too much about this, but an expansion of our imaging services on the first floor. All of these things will be very impactful to most everyone that works in the hospital. And I think that will be a big focus over the next few years. That, along with Epic, will be building our what I call our physical infrastructure. So we've done services, we're going to make them tight and run well, and we're going to really focus on physical infrastructure. So that will take us through 27, 28. And in the meantime, we have to take care of patients. Now, a couple of comments on that as well. We went through, I think, almost a month-long period where we were busting at the seams. I think the community had a bit the COVID outbreak. There was some of that running around, and that along with a few other factors, which I'm not exactly sure what they are, really drove us to be very, very full. I want to call out and mention a few folks that I thought were really above and beyond in managing that whole that 2, 3, 4 week process. Our house supervisors did a really great job. Yvette in particular, I thought did a great job managing that that daily kind of struggle to figure out where everybody went. OB, great work. I think OB overflow was open almost the whole time. Our short stay overflow also open, both of them almost the entire time. And certainly our emergency department, you guys, how you operate on half your beds is pretty dang amazing. Many other people worked hard. I don't want to leave anybody out, but I thought those were some individuals to truly acknowledge and express our appreciation. Things have settled a bit, meaning that we're just full and we're not over full, which in itself is kind of interesting. As we do these various plans, plan these projects, we know that we're going to also have to have good plans in place for being full while we move these departments, while we take down spaces, and we are trying to stay 1 or 2 steps ahead of the process. So for some of you who may worry that we won't have a way to figure this out, we will. And I'm sure that we will all rise to the occasion. So, a couple other things. Let me see, check my notes here if I'm leaving anything out. I think I can probably go straight to questions. You guys can actually, Kris, I think you did the striking question that came up quite a bit.
I did.
You did the food. I think you hit everything. So it's interesting. I had probably a third of the questions were on those 2 subjects about night food and about striking in the parking lot. Okay, so you took care of that. So this should go pretty quickly. Do we have any questions on the side there? I'll see if I can do one of those. You know what? We got a longer table in here, and I think that's just become a problem. Are we going to be expanding many of our departments, especially the finance area, ambulatory finance, business office, etc., to meet the needs of the expansion? That's a very good question. So as you probably have noticed, there's a lot of domino impacts on whenever we do anything. So right now we have everyone jammed into the hospital. Everybody has a space, but it's a little, well, it's tight. So when we open this administrative building, which we knew we needed to have, that will decompress many of the other areas where people are crowded up. And it will also open up some of the areas where people are now that are moving into the new ASB. And how does that impact groups like finance and others? Well, it gives us more flexibility to sort out how we address their issues as well. So I'm thinking just by adding more space, we will be able to get people, I think, in a little more comfortable environment when it comes to when and how they work. So yes, it is on the radar. I don't know exactly, but keep mentioning it and we will make sure we pay attention to it. I said another one, you also said we will be doing a large construction project in Ka'u, which includes expansion of the clinic and needed services to the area. So, hey, Erica, how are you? Good to talk to you. Kris, you want to take that one?
Sure. So we were going to try to do 1 or 2 projects at a time for each town hall, but absolutely, Erica, we are expanding the Ka'u footprint and we're expanding some of the administrative services out in Ka'u. We anticipate that project to start in November, actually no later than November 2024. And we're starting with the wastewater treatment plant. So they'll be starting with the underside of the building that has not been completely built out. And then the wastewater treatment plant that would be over in the yard, or the lawn, I should say, out in Ka'u. And Jenny Rowe and Kyle Usui, who is new to our team, they'll be leading those efforts with Erica. Welcome Erica and her team as well in Ka'u.
So I think on one of our town halls, maybe the next one, or probably we can do it for the next one. So Ka'u has been doing a lot of what we've been doing here at Hilo Benioff Medical Center and doing internal renovations. The place is starting to look really, really good. They have their own reno team. So we'll share some photos, some before and after, and we'll also do some visuals on what the Ka'u project is going to look like as well. So good question there. And yeah, we keep doing this so we have content for the show. You know, that's really what it is. It's not really. So point of care question about that. With Epic, it does have the capability to incorporate point of care results into their lab result screens. We're not 100%. We don't know 100% right now where exactly that is, but that is part of the build. And so, yes, point of care testing would be, I guess, the results would be conveniently available in Epic. I'm sure whoever, if this has been or others that work with this, we'll be sure to involve you and make sure that that is done well. All right, and then will there be, we did the,
Will allow the care services.
oh. Well, a lot of the services our Ka'u residents drive in for be offered at the Ka'u facility. That would save a lot of Ka'u elders from driving to HBMC. That's a really good question, and that's a tough one to solve. I know that one of the biggest things that have been mentioned in Ka'u is having dialysis services there. That's just challenging. Ka'u has a small and remote population, so it's very much a burden on those guys to get the whole breadth of services you can get in more of the population area. We are working on a project to have more outpatient services in Keao, which is closer than, up the hill here in Hilo. It's not like it being in Pahala or Nahilehu, I understand that, but I think it will help to an extent. I like to say that, we can get everything we have here in Ka'u. I'll be honest, I don't think that's going to happen, but I think we can improve it. Okay. All right. We'll just jump right into some of the questions that were asked. There were always, when I get asked for town hall questions, I get some, I think I call them venting questions where people are a little annoyed about specific things. And if it's very specific to your department or maybe you as a person, I will send that to the manager or to the MT, but I don't generally read it here. But I do read most everything. I also get a number of questions that are very similar in theme, like Kris took care of that with the striping and the food for nights. We got a number of questions on patient transport on the weekends. So we are doing our research on getting a vendor service available on Saturday and Sunday. Right now, if you want to try to get a taxi or other types of services available during the week, they just aren't there, especially on Sunday. And sometimes patient transport, even for discharge patients, can be a little challenging. So we're going to try to find a service that we can contract with, similar to how we like valet or others that would be available. So patients can, without family members to pick them up, can get transported home. We don't have to hold them over the weekend. This is really important, and we're very pressed for beds. So we're working on the solution for that. More to come, but I think for those who put those questions out, it's a very legitimate issue. Also had a number of questions on Epic and Epic training, in person versus remote and so forth. The question was, well, why can't we go and have in-person training on the mainland, especially if we're perhaps willing to pay for it? Why would it have to be remote and so forth? And without getting into specifics or people's individual concerns, in general, most organizations these days do their training remotely. Bluntly, it's very expensive to send individuals away for training. If we send someone to the mainland, by the time we do airfare, food, travel, board, room, it's over 10 grand a week. So it's very expensive. Almost all of our EPIC training is remote, and we've decided to do that as an organization. Now, I know there are some of our staff that are excited about it and maybe have the resources and the money to pay for it themselves, but a lot of our folks don't. And we really don't want to create those types of inequities. And it's also a little tricky when individuals are spending their own personal money for organizational initiatives. All that gets kind of muddy. So we're going to stick with remote training for almost all of our EPIC build. There are certain times where we have to go in person, but management will figure out, when that's supposed to be. I am really excited about everyone's enthusiasm for the project. So please don't take that as we're discouraging your excitement about, learning a whole new set of skills. Okay, we did this. There was some questions about safety concerns of the cottage. I think this has come up at different times, and I know that it's because it's come up, even though I referred that on to Kris and Joni. I think a lot of it is just, it's a remote location, meaning that it's away from the main house. Excuse me, I have a plug in here. But it's away from, the main campus. I think the questions in the past, we put security up there as a permanent presence. And right now, we don't plan to do that. We have security cameras. And of course, we have security available to drive up and, respond to a call or concern. I think we're going to continue to take that approach. We have invested in better vehicles for our security. They have these cool little, well, they're not little.
Leaders.
Yeah, they're, the utility vehicles. So they get up there a lot faster than the golf cart. So I think they're certainly available if you have any concerns. There was a question about nursing recognizes those who hit certain milestones for years in service. Why does only nursing do that? I think it's great that nursing does it. That was an initiative that they felt like that they wanted to undertake. I've been here a long time. At different times, different departments have acknowledged years of service. We haven't, in a organization-wide way, decided to do that. We generally, we have a process now, I think, which is pretty good when people retire to acknowledge their service, and I think they get a plaque or a paddle and so forth. But we haven't decided to do that in every area. We can take a look at it, but I'll just applaud nursing, and then we'll have some discussion at executive team if we want to do that organization-wide. Someone asked, and I think I know the answer to this, but is it possible to have the cafeteria set up a delivery service to on-site locations that are attached from the acute building? And I should just say, no, I don't think that's going to happen. I mean, it would be great. I know some of you guys at the campus has gotten bigger and we're using all of it. So it does take a while to walk to the cafeteria, but logistically, I don't think we can do the DoorDash version and kind of bring you food. But I can see why someone would want that, though. I would like that myself. Get a number of questions on this, not only for town hall, but when I see folks in the hall, on the status of the hazard pay between UPW and HHSC. So a couple of things. So UPW and HHSC is really not how hazard pay works. Hazard pay is being negotiated at the state level. HHSC in itself is a jurisdiction, and we have contracts, bargaining unit contracts with our various bargaining units, but we are also part of the larger state footprint, and we have been negotiating, or excuse me, included in the global negotiation by the state for all their departments, like Department of Water, Department of Education and so forth. We wanted to be included in there. So when that grouping comes to agreement with UPW, that would be how the hazard pay settlement would be paid. Now, I know this has taken quite a while. HGA agreed to a global settlement. UPW decided to not go that route and has been working with individual jurisdictions instead. I know that there's been some progress made there. I don't want to predict other than to say, I think there will be a settlement eventually at some point, but this probably isn't the forum to speculate on how much or what, but I know that it's being actively worked. Generally, these types of settlements, the numbers are large because it's a large number of employees. Money has to be appropriated to pay for it. That requires a legislative session and actions, and we are not in session now, and session starts in January. So my thinking is that whatever the settlements work out to, and I've always tried to just be straight up with you guys, I think it's going to have to be funded, and odds are that would take place in this next session. So it will take a while to have UPW members, again, just my opinion, their settlement payments make their way to them, but I do think that eventually you'll see something. Okay, so I hope that was specific enough, but I didn't overstate the case. There was a question about breastfeeding. We as an organization celebrated World Breastfeeding Month, and I know that our OB unit, as well as we have what they call a CHAMPS program, which is a way to promote breastfeeding rates in the community. Basically, this was a pretty long question, but we don't have enough places for nursing moms to pump. And I would just agree with you right up front. We could certainly have more. We're very pressed for space. We meet the minimum requirement. I would agree with all the nursing moms out there. They aren't convenient enough. The way that we plan to address that is through the physical changes to our infrastructure. Opening the expansion will create a ton of space for us across all our departments. You will be really surprised at how large a unit is, a new unit these days, and that does give us a lot more flexibility to create spaces for breastfeeding. Also, when we get this administrative building up too, that will also free up spaces like offices or others that could be located where you could have a breastfeeding spot on each floor versus I think we have one or two now.
And there's a breastfeeding room in the expansion.
There's a dedicated one in the expansion as well. So I just would ask for your patience until we get there. I know we have lots of moms and we want to be supportive. We had looked into lactation pods. They come with issues. They're not like a magic solution. And if you've seen those pods, they kind of take up almost the footprint of a room, of an office, and we don't have open space really to do them very easily, not where I think people would feel comfortable. So we know it's the issue, and we hope we'll do better here over the next couple of years. There was a question if we as an organization would be providing any fertility services like IVF, IUI, etc. I think in most cases you have to go to Oahu for those services. Right now, we don't have plans to do that. That is it very much its own specialized service, and I think it will have to get a bit larger before we could offer those services in a sustainable way. So unfortunately, I think we'll probably still have to catch flights to Oahu. A pretty long question here regarding having a dedicated rapid response and code blue team. And I think the way I understood the question is not one that like now when you call a code, people who are carrying the code pager, they have certain pre-designated members and they go and respond to the code or to the rapid response. It can be if you're, sometimes it's just luck of the draw. You may have 2 or 3 or 4, and other days you may have none or go a long period. It just depends. It can be disruptive to caregivers' work schedule and so forth. The hard part about having a designated team that just kind of basically waits around for these type of events is it can be very expensive. It can tie up, I guess, the services of a really group of highly trained people. And I don't believe we're really at the size of an organization where we could, afford to just have a code blue and a rapid response team. I've also seen operationally that when you dedicated that to just one team, everyone else loses practice. And what happens is there's a bit of this hands-off approach. And our caregivers, our nurses and others, our RTs, they get rusty. And I don't think that's a good thing for the various units. So I'm sure we'll have some more discussion around this, but again, you put in the question, I'll try my best to answer it here. And I think we went through pretty much everything there. There was a couple others here, and this is really testing my vision. You want to do one?
Sure. The first one was from Monica, and it was parking, and it was mentioned in the past that staff could park anywhere after hours. So we talked a little bit about that yesterday.
Yeah, so let's the definition of anywhere, okay, and when after hours is. So anywhere is not, again, I have to be very specific when I answer these questions, not in on-call stalls, not in handicap stalls, okay? So we have a number of designated on-calls, so you just can't be there unless you have the placard and you're assigned there. After 5 o'clock, you can park in physician parking, you can park across the street, you can park in patient parking. Generally, there's many spaces available after 5. So after 5, have at it, but not handicap or on-call spots.
The next one is a conversation about our CT machine and having a stock for common repair items to expedite repairs. So I can take this one for.
Oh, yeah,
Go ahead.
I'll go for it. I mean, I could, yeah.
So the vendor of our CT machine does have a depot. It's normally in Oahu, and they do carry some of the the parts that often fail. Unfortunately, what's happening right now was just kind of this double fault failure where we didn't expect things to quite go that way. I believe they are working to get the part here by 7 o'clock tonight, and Lori and the whole imaging team and Lisa and her team can. Lori says she can answer if you need me to. Go ahead, Lori. I don't know if you can take yourself off mute. It's okay. I think I can't. Okay, it's okay. I think I got the gist of that, Lori. If not, you can certainly type in the remainder of what you would like shared on the town hall, but pretty much most companies carry their parts on island, or not exactly on island, but in state.
Yeah, so we've definitely had this come up before. We have Siemens imaging systems, and I remember we had some serious discussions with the vendor about having parts at minimum on Oahu, and we couldn't wait for them to ship them from, say, Minnesota. I think both of these CTs are Toshiba's, and so that's generally been our expectation. But sometimes parts break that are not, as Kris said, in that depot. We have gotten better support when it comes to service technicians and so forth, but I find it just as frustrating as you. That's one of our big reasons we wanted 2 CTs or 2 of everything, is to have this double redundancy. But my response when both of them were down is like, really both? That was the point, right? To have 2. But I think this has just been a bit of a bad luck thing. We will do an after action review and just dig into if there was anything to do to make this even less unusual, less likely, you know what I mean, right? Because it's not good. I think CTs have become so crucial these days to almost any type of diagnostics. Let's see, something from Felicia. Our staff able to park in admin parking after 5. You can park in my stall after 5 if I'm not in it. When we say any, it really is after 5. If it's open, feel free to park in it, unless of course it's on call or handicap. I think that's a clean way to delineate where you park or not.
There was a question above about the vans. Cafeteria should have a call-in system. So we'll take that under consideration. It does say that the tray line menu has changed likely by the time people come down. And normally that's because we've sold out of an item. So we're adjusting as we see more people coming into the cafeteria, and then we're offering more grab and goes. I know we've been we've been trying out the sushi machine. I don't want to put that in the town hall, but we have been trying out the sushi machine. We're really excited about it. We're trying to find a way to just increase those offerings of grab and go, so if you don't have time, you can at least grab something and get to the cash register.
All right, and what is the expected events of remaining in have?
What is the expectation? So
What is the expected time for staff parking in areas available after 1700 to have vehicles moved in the morning? Oh, that's a good point. Generally before I think it's before 7:30.
it's usually before 7 a.m.
Well, so the night shift often parks, right next to the building, which they should. And they usually are out of here by 7:30 in the morning. That would be our expectation too. And 7 is a little better, but I think 7:30 would probably work as well. But no, you can't hang in there till like noontime. Okay. All right, so why don't we just stop there with questions? Parking is always a hot issue. But again, thank you everyone for your patience and your hard work, especially as we've been so busy. Our mission is so important. And just to remind you all, we're caring for our family, our friends and neighbors, and it is a really great mission. And it's a wonderful thing that you do. So have a good day. Aloha.